Oh, Jarrett Orthopaedic surgeon speaking. I'm going over a talk I gave twice so far, once at the Australian Hand Surgery Society meeting in Adelaide in April this year, and then I've given it at the Western Australian Hand Surgery Society more recently. Topic is, with a transducer in hand, a surgeon will give you the truth. I have no declarations of interest. So effectively, this talk is about, is it worthwhile having an ultrasound machine in your clinic, both from a professional viewpoint or from a patient's viewpoint. And this image we're seeing here is one of the very small veins superficially near the surface in my forearm. And you can see how wonderful ultrasound is. You can see the flow of blood through a very small blood vessel indeed. And you can see a very small valve with the little valvelets fluttering. So the quality of the images now is extremely good and can be very useful in making diagnoses in patients. So one question would be, why is it worthwhile considering having an ultrasound machine in your clinic? And effectively, it makes it much more of a one-stop shop. So if a patient comes in to see you and it's going to be of value of them having an ultrasound, then you can do it there and then. So there's no situation where the patient's heading off, going subsequently to an ultrasound clinic either later that day or very commonly on a different day, then coming back on a second occasion. Sometimes in our clinic they come back the same day, and so the inconvenience isn't too great, but quite commonly they're going to have to coming back another day. So it's very much less convenient having an ultrasound somewhere else. So if we're able to do that in the clinic, then that's very valuable for them. Second thing is that it's genuinely interesting as a surgeon. You get to be able to see inside people. That helps in the diagnostic process and it's very useful. And the final point I've made in my talks is that whilst an ultrasound is a very impressive gadget, that is not a good enough reason to buy a machine. It's got to be of genuine value. The next thing is that clearly as surgeons we're not radiologists. We haven't had many years of training in imaging, including ultrasound, and therefore if you're going to take it up as a non-radiologist or a non-ultrasonographer, clearly you've got to do a good job, and therefore you have to have sufficient training and have to work out what are you going to ultrasound, how are you going to get training so you can do that well. Then once you're up and undertaking ultrasound in your clinic, you need to make sure the quality is good, so you need to audit your results, and you need to continue to have education going forwards to ensure that what you're doing for patients is excellent. As surgeons, we do have some advantages that the radiologists and ultrasonographers have less access to. So we have a readily supply of patients, but also we've got very much more rapid feedback compared to the radiologist. So often I can be doing an ultrasound and then maybe an hour later I'm doing an operation on the area where I was doing the ultrasound, and so immediately, within a very short space of time, I'm getting feedback as to what I saw in ultrasound, was that indeed correct? And then I get to follow the patients up so that if we were thinking an ultrasound showed something, as they progress and improve in the way we would expect, that gives further feedback. Also, if I take specimens such as histopathological specimens and send them off, I get to see them back, and so I get feedback that usually wouldn't be available to most pathologists. So surgeons, we have some distinct advantages as an ultrasound practitioner. I did, before I started doing musculoskeletal ultrasound, have some experience in cardiac ultrasound, having undertaken some cardiology, transthoracic and transesophageal echoes. So when I decided I thought I would like to undertake ultrasound in my clinic, first of all I read about others' experience of this. I spoke to a number of my colleagues who had ultrasound machines in their clinics. So these weren't other orthopedic surgeons mostly, but other practitioners in general practice and obstetrics, and as their experience. I read a number of books and I went on a course, and then subsequently I've gone on a course again in 2018. So at this stage, I felt that it would be genuinely worthwhile having an ultrasound, and explained to the audience in the talks that roughly there's three types of ultrasound machines. So the machine you can see here on the left is rather like a Reliant Robin. It's a fairly inexpensive machine. It might get you where you want to go or may not, but it's not a particularly high quality machine. These are machines that would be inadequate for our use. Now the machine on the right is the machine you would more commonly see at a very top of the range radiology clinic. These machines are very expensive, but also require really quite a lot of tuning to get the best pictures. It's like driving a Formula One car. Most people getting in a Formula One car are going to stall it and not manage to make it perform well. And this is the same with an ultrasound machine. If you're spending all day, every day doing ultrasound, then you're probably going to get a very good picture from this machine. In fact, the best of these three machines. But if you're using it less frequently than that, then actually you may get the best image from the machine in the middle, which is the machine I have, which is a kiosk machine that costs around about $55,000 and gives excellent pictures, but it's got a high degree of automation. So it's a bit like this Tesla car that you can see. Most people could get in that and drive extremely well. And this is the same with this machine. You do have to go through some processes to get your machine and your practice accredited, and that is relatively straightforward. This image here is some pictures from the British Shoulder and Elbow Society, and they set up a committee into how best for surgeons to introduce ultrasound into their practice, and what they suggested is that people should go on a course. Then they should do undertake a number of ultrasounds to become proficient at using the machine, and then undertake ultrasounds prior to operations and compare the images found at operation and just before to assess how accurate one was becoming, and then do that for a period of time, compare your results, and eventually when you got to a stage where you're very accurate, then starting in clinical practice. And so this is what I did both for hand and wrist and elbow and shoulder. This again, the feedback mechanisms I've mentioned. So other imaging, occasionally I'll undertake ultrasounds that other people have ultrasounded and get feedback from that, and operative and histopathological information. So in the first 32 months of having my ultrasound machine, these are the pictures, these are the number of cases I did. So mostly hands, but the number of elbows and shoulders and the number of injections. And on the right, these were the referrals I made for imaging. So that was 212 ultrasounds and nearly 700 MRIs. And a lot of patients were also coming to the clinic with imaging prior. So what I was using imaging with ultrasound for was a highly targeted cases where I felt it was going to be useful, or sometimes where other people had done ultrasound and they simply weren't giving me the information I was required, and I was effectively having to redo the ultrasound. And these were the reasons I was undertaking the ultrasound. So a lot of trigger digits and ganglions in situations where patient had metalware in and was the metalware interfering with any other structures, joint swellings, lesions, extensive tendon problems, and then other things less common such as fingernail pathologies, abscesses, foreign bodies, clicking joints, etc. So here's some examples of images that we've taken for patients. So the left is a dorsal wrist ganglion. On the right is a lipoma in the dorsum of the hand. This is a finger ganglion on the left and a lipoma, fibrolipoma on the right. This is a vascular lesion on top of a thumb interphalangeal joint. And you can see the ultrasound pictures and the Doppler showing the vascular supply through there. These are some pictures of triggering, which has got some very classical ultrasound appearances. And this shows an X-ray on the left where there's a metallic foreign body, and you can see that on the right in the ultrasound, sitting just outside the flexor tendon sheath. These are some flexor tendon injuries, partial and complete. And this was some metal issues. So there's a flexor pollicis longus tendon very close to a plate, and there's a dorsal wrist screw and a fingernail on the bottom picture. So I'd said the advantages of having an ultrasound machine in your room is a bit like the advantages of having a digital camera compared to a film camera. In a film camera, you have to take a picture, then send the film off, and then wait some time before you get the images back. Whereas a digital camera, you can take a picture and immediately see and use it. You get to, as a practitioner, explain in real time to the patient from a surgical point of view rather than just a pure radiological point of view what you're seeing, and so that leads to better patient education, and you get better at interpreting other people's ultrasound images. There's some genuinely large advantages. There's some disadvantages. The machines are quite expensive and time consuming, and it's difficult to learn how to do it, but personally I think this is all worthwhile. So in summary, you require some training, some expense, but it tends to be very accurate, fast, convenient, and genuinely an option for surgeons. Finally, this is a picture of it's a very small digital artery, and again you can see what details you have. This is using a 70 megahertz scanner, a slightly different machine to what I typically use. So thank you for watching, and best of wishes.